Hi, thank you everyone for joining in this second in our series of webinars on all aspects of the NTRR. All of our webinars are recorded and made available on demand on our website, and eventually they'll also be on the NTRR public site itself. In other words, you won't need an account in order to view them on the NTRR site. I'm Pam Bixby, Deputy Director of the Coalition for National Trauma Research, and I serve as the overall project manager for the National Trauma Research Repository Project. And we're really happy you're taking the time to learn how to use this free resource and help it grow for the benefit of the entire investigator community and ultimately for the benefit of trauma patients. I just have a couple housekeeping notes before we get started. We have muted everyone for now, and if any questions come to mind during the course of the presentation, please drop them in the chat. I'll keep an eye on that. And I will raise those when we get to the Q&A portion toward the end. Then I'll unmute everyone and you can to allow for additional questions that you might have. Feel free to raise your hand at any time, and then during that time, and we'll get to you in an orderly fashion. I'd like to introduce our presenter for today, Nick Medrano. Nick is our NTRR operations manager. He's been in the thick of it the last couple of years, working with dozens of subject matter experts to identify and specify common data elements for the NTRR data dictionary. He's also responsible for facilitating the data submission and access functions of the system to ensure that users have a smooth experience. And he works with his counterparts at NIH to ensure the interoperability between FITBUR, the FITBUR information system, and NTRR. He will be your expert guide through the system modules today. So with that, Nick, I will turn it over to you.
Thanks, Pam. So as Pam mentioned, we'll be going over how to use the NTRR today. This is only our second webinar, so we're still kind of in an introduction phase. Today we'll be focusing on talking about the different modules that exist in the system. As a review, last time during webinar 1, some of the things that we talked about is, first of all, what is the NTRR overall, the National Trauma Research Repository. It does use the BRIC system, which is an NIH built infrastructure. So there are many other repositories that use this same infrastructure. We talked about the difference between a data registry and a data repository. So a data registry, many of you are used to using a very select number of elements that kind of everyone collects. And extremely powerful data registries, but a data repository is meant to house clinical data from research studies that are going to be collecting much more specific types of elements that wouldn't be collected in a registry. So the NTRR is a warehouse to hold that study data. Reasons for using the NTRR, of course, increasing the visibility of your research. So if other users want to, let's say, complete a meta-analysis of your study data will be receiving a DOI upon submission. So you'll be able to be sorted and cited as and get credit for other users analyzing the data. Of course, fulfilling data sharing requirements, right? When you're submitting your grant, many times you are required to state where your data is going to be living. This is an NIH housed environment. So for any NIH study, it will be a great place to hold your data. And then, of course, at the end of the day, we're all researchers trying to contribute to advancements in care. So the idea being, if we have all of our data housed in a central location, that makes meta-analyses a lot easier, and the data becomes much more powerful when we can aggregate it. We talked about common data elements, right? CDEs, which are used in the system to ensure that PIs are collecting data and submitting data in a standardized way so that that data can be aggregated more easily. We talked about 2 of the modules last webinar. Mainly the data repository and the meta study. These are the 2 different environments that can hold the data. So we talked a little bit about the differences between those. I'll touch on that again today. And then the main part of last webinar was to focus on if you are interested, you think that this system might be something that be useful for you, is the difference between our data access account and our data submission account. So what are the different account types? How do you want to apply for an account? How does that process work? It's a completely free process, but if you are interested, as Pam has mentioned, that webinar is available for you, or you can always reach out to me and I can help you through that process. Finally, that kind of leads into our final point, which is Center, a Coalition for National Trauma Research. That's myself, Pam, and many other staff members who are here to support you in use of the NTRR. If you have just general questions about it, you are interested in, let's say, having a data use language in your study, in your grant submission, if you're interested in getting assistance with submitting your data, right, that's what we are here for. So that was webinar 1. Webinar 2, we're going to be going over a little bit more in depth now of how the system actually functions. So we'll be going through these different modules. These modules have a lot of depth to them. So because I'm going to kind of use today as kind of a foundation for getting you introduced to all the different modules to get an idea of what type of functionality the system has. And the idea is that moving towards the future, we'll delve deeper into some of these modules because they are quite deep. Here's kind of a list of these modules that we'll be going through today. What I'm pretty much going to be doing is giving you a brief overview of what the module does, and then I'll be popping in and out to the actual NTRR itself. So you'll be getting kind of a demo as we go along, looking at the actual live repository. So I want to start with the two that we've kind of looked at already. So that would be the data repository module. So that's where you can contribute and upload your research data. The repository itself is going to house studies that have adopted those common data elements. Once again, those kind of standardized ways of collecting data. It can also hold images, so I'll talk about images a little bit later. This is where also you can define and manage your study. So the idea being you're collecting the data at your site. When you have your data all completed, that's when you'd be submitting it to the data repository, where you are going to include a lot more information about your study as well, other than just the data. So that way other users can have an idea of what is this study about, what type of data exists in this study, inclusion, exclusion criteria, things like that can be shared in the data repository. And then, of course, you can search for the existing studies. What other studies live in the system that you could, potentially request access to run meta-analyses on? So I'm going to now pop into the system live. So this is what the system looks like when you first log in. To get to this point, you would need to apply for an account request. So that's something that I can assist with, and something that we covered in webinar 1. This is what kind of the homepage looks like. It's going to have all of the images here for the different modules, but you can also get to those modules here across the top. These tabs take you to the same place as clicking on these icons. So starting with the data repository, we can click on that. And that's going to take us into the repository proper, which once again holds the studies. So it not only holds information like the title, organization, and PI. I'll get into one of these in a second, but also the data itself. So first of all, we covered this last webinar, but as a reminder, the NTRR is kind of a sister repository with the existing TBI repository, or FITBR. So you're able to cross-reference between these two repositories, and you can do that by selecting this resource here. If you just wanted to look at FITBR, you can just turn off NTRR. If you want to look at both, you can turn on both. Or if you just want to look at NTRR, you can do that. Now, because this system has just gone live, and studies, as you all know, take a lot of time, no studies have gone through, their whole completion process at this point, because the NTRR has gone live just this year. So, but you can still reference any of these existing FitBER studies. To give you an example of what type of information you can look at here in the repository, let's pick one here. Which one did I want to look at? Let's look at this one here and try and make this a little bit bigger for everybody. Let's look at this prospective study on therapeutic and adverse effects of medical cannabis for chronic TBI. You can see we have the organization, the PI, the number of subjects that are in that study. If we click on the study, we'll get a lot more information about the study. So we can get in the overview, we can look at the abstract, the aims of the study type. We can also look at sometimes summarized data from the study. So in this case, the only thing that we're showing publicly is the different image types that were taken, as well as the breakdown of the subjects by their age. We can look at the details of who the PIs are on the study if we are interested in getting in contact with them. Their contact information is here. Associated subjects, right? Here are subject ID numbers, GUIDs, for the subjects that were enrolled in the study. Documentation about the study, as well as the data sets themselves. So all that information here for this one study, we would then have the ability to go through these data sets and download them for future analyses. Once again, something you would apply for request to get access to these. So that's kind of viewing the studies themselves, which you will be doing from the data repository. And then if you were enrolled to submit your study to the NTRR, this is where you would also go through the process of creating your study that's going to hold all of your data. So that's something that I would assist you with. We would have set up a call, a one-on-one time to kind of walk you through that process. That's why we're here, to make this as easy as possible. But this is where we would also be creating that study itself to hold all of your data. So that is the first module, data repository. The second one is the meta study, which is another one that we talked about last webinar, which is another place that can hold data, but this is going to hold data that did not adopt common data elements. So what we're mainly using this for right now is legacy studies that have already been completed before the NTRR has existed. The DoD has identified some that they would like to input into the NTRR so that users can access the data. But those data sets aren't going to be able to really harmonize as well across from each other because they don't use the standardized common data elements. The meta study also holds meta-analyses from data repository studies. So if you wanted to, let's say, aggregate data across studies from the data repository, you could then house that meta-analyses here in the meta study. So popping back into the site, if we just go back to home, we can get to the meta study by either clicking it here or by going up to the top tab. The meta study, very similar in terms of its structure to the data repository, except it's just a different set of studies that didn't adopt common data elements. So you can see here, again, we can filter by looking at NTRR specific studies. So here are studies that we've been working on submitting. These studies have already been completed in the past, and now this data has become available for users. And then once again, you could also cross-reference with FitBER studies as well. So between the two, we've got about, 37 studies in the meta study. If you're interested in the data repository, I want to say it's around 280 studies that you could potentially filter across. Yeah, 282, right? So, and the idea is that both of these are going to continue to build and get larger. So that is the meta study. Popping into our next module, the data dictionary, right? The data dictionary is going to hold data elements. So these will be those common data elements I've mentioned. Users also have the ability to create unique data elements, right? We understand that if you have a study on a very specific topic, there's the potential that a common data element doesn't exist to collect that type of information. So that's again something you would work with myself to identify what common data elements already exist that you could adopt, and then what type of unique data elements would we need to create. So you have the ability to search for those as well as then download them. So if you wanted to, let's say, import them directly into REDCap, you could do that. And then you also have the ability to create things called form structures, right? E-forms, setting up repeatable groups or setting up, a list of variables that you want to make sure get collected together in a specific order, right? Which I'm sure many of you are familiar with doing. So moving back to the repository, looking at the data dictionary, we can search for form structures over here on the left, or we can search for data elements, whichever one we want to search for. And then again, do we want to search for NTRR specific form structures or NTRR specific data elements? We can do that. Or we can also search across both repositories. The FitBIR repository has been operational for over a decade now, so you can imagine there's quite a list of common data elements that have been created for it. So you can see currently the NTRR is close to around 500 common data elements. The work that we've been doing over the past 2 years is working with subject matter experts to identify these and define them, ideally using already existing definitions for them. So here we could do a search, right? If we wanted to search for, let's say, let's just go with drug screen. So let's just type in drug. Right, we could then see the different common data elements that are different ways in which we can collect, drug screening information and results. Medications, right, is another one. Injury, ICD codes, things like that. You can search anything you want here, and then it'll populate out what items, what common data elements already exist in the system. Next module is subject management. This is really related to, as it states, managing your subjects. The system creates things called GUIDs, Global Unique Identifiers, and that's to ensure that the system doesn't hold any PII, right? But we still want to potentially be able to track patients, especially if they're enrolled in, potentially very long studies or multiple studies. We want to be able to track that specific patient, giving them an ID number. So this is kind of where you'd be able to do that. In this system, you would put in a certain list of PII. That PII isn't stored in the system, but that PII is used to then create a GUID. And that way, in the future, if you had another patient that you were enrolling, you could put their PII into the system. It would search on the back end and determine, has a GUID already been created for this patient? If not, it's going to create a new one. So popping into the system and go back home, we can go to subject management. And here's where we would really be focusing on creating subjects using the GUID tool, right? So this system's going to use PII in order to create a GUID, but no identifiable information is going to be in the repository for others to be able to potentially identify a patient. Something that is very useful and needed, right, is the ability to query the data, right? We're going to have all this data living in this repository, but how do we actually query it so that we can gain access to what we're interested in? So that's what the query module is for, filtering the data repository based off of whatever your research question is. You can query data based off of the study. If there's a specific data element that you want to identify, who collected that element, what studies collected that element, or if there's a specific form that you're interested in identifying who's collected. So, if you wanted to look up GAD, for anxiety and see who collected that form, and then aggregate everyone who collected that form, right? You could do that using the query tool. You could then, after doing your query to identify the studies, you could then do, let's say, a Boolean search to, let's say, filter further by age group. Let's say, for example, you wanted to do that. You could definitely do that. And then downloading the results, of course. And the idea is that the query tool, if you wanted to run a meta-analysis from aggregating data from different studies, is that then that data would still live in the repository. That data would live, in this case, in the meta study module. That's where it would live. And then you could still reference it when you wrote up your publication. Your new data set would have its own unique DOI referenced. So the query tool, this is something that I imagine we would allocate, maybe a whole webinar to, of giving a use case of, a very specific list of criteria that we're looking for, and then how do we go about navigating through the query tool. I will be honest, it's not it's not the most intuitive system. So it's again something that we will share more information about in the future, or is definitely something that if you were interested in running analysis and you wanted some assistance, I can easily jump on a call and help guide you through how you'd filter the data. But very kind of broadly, you can search by forms. So if you wanted to search for, let's say, as I mentioned, GAD earlier, you could see how many studies then collected data using GAD. So in this case, 8 studies, and we could select that. And then here are those 8 studies over here on the right-hand side. You can see the name of the study, who the PI was, how many subjects they had, as well as how many other forms they had. So if you wanted to, let's say, kind of cross-reference forms, see GAD, but then also, combine that with another form, you could do that. So we could do it by forms, we could do it by study. So if we wanted to say, look for, you knew that there was a specific study that you knew you wanted to look for and analyze the data, right? You could do that. So we could look for that study that I searched earlier, that effective cannabis on chronic TBI. So we could get just that study's data. And in this case, you can see what were the different forms that they used to collect their data. So here you can see some imaging, alcohol use disorders, other imaging. They use the PROMIS anxiety form as well. And then the idea is that you could also see, so you could just download data from this study, but you could also see, based off of what forms they collected, what other studies also use those forms. And then you can also search by data element. If there was a very specific data element you were interested in searching for, you can pull this up and search for whatever type of data element you are interested in. So what did we look for earlier? Let's say drug screen, right? Let's see whether a drug screen was completed or not, right? A drug screen indicator. How many studies completed a drug screen, right? So you could search based off of that and add that element. You can see that element itself is actually a part of 2 different forms. And then you can see how many subjects there are that used that form. So in this case, there's 57,000 subjects who used this specific form, and that form has drug screen as an element that was collected. It doesn't necessarily mean there's going to be information for every single one of those subjects for this specific element, but then we would download the data and then we could further filter to tease out just those that have actual data submitted for that element. So you can imagine it can get quite complex. You can also have the ability to then save queries. So if you built out a query to, get exactly the data set that you wanted, but you needed to come back to it later, you could save that query so that way it isn't lost. And then you could just come back in and then run that query that you've saved to get back to where you were in your, filtering analysis. That's the query tool. There's other tools, right? Downloading data, submitting data. When you do submit your data, we do have some kind of validation tools to ensure that, to kind of catch and ensure that the data makes sense for what's being submitted. So for example, if a data element is, systolic blood pressure, right? It should be numbers and it should be in some range that would make sense, right? I think the standard in the program that we have it assigned is any number from 0 to, 300. And if the data in that, for that element falls outside of that range, then the validation tool is gonna flag that as, we have some data here that doesn't make sense for that element. So we can kind of catch it before we're submitting the data and allowing it to be public for others to use. Image packaging, we can submit images as well. Data element to UMLS mapping tool. So if you have a data element, we can map it to UMLS codes, which is very useful. And then kind of vice versa. We can take kind of FHIR protocols and try and convert those into CDEs, looking at what CDEs exist already and trying mapping those. So popping back into the system, we can go to just all these other tools here. Downloading tools. So if you wanted to download data from a specific study, we would have selected it and said, hey, put that in my queue to download. And then we would launch this tool and all of our items that we've selected for download would exist here. Validating your data, of course, is very important to ensure that when it's getting submitted, right, we're catching those potential errors in the data. Image packaging, right, using typically DICOM formats. So if you have MRI or CTs that you want to submit, the system has the ability to house that data. Mapping data elements that exist to existing UMLS codes, which is very useful. And then, as I mentioned, kind of the flipped around here, if we have FHIR profiles with existing elements, trying to map those to existing CDEs in the system. Finally, the Proforms, which is a completely optional module. This module is used in place of, it is a data capture system that exists and lives inside of the NTRR. So well aware that many of you have your own data capture system that you're used to using, and by all means you can continue to use those. So RedCap, for example. If you're used to using that, keep using that. But let's say maybe you're a newer investigator and you don't necessarily aren't as familiar with any, it could be useful to just collect all of your data in the NTRR data capture system called Proforms. That way all your data is already kind of living in the system. So there's the potential to use that. This is another one that's, you could imagine is quite complex to learn how to use. So one that is another potential future webinar if you're interested in adopting and using Proforms instead of another data capture system. But at the end of the day, you can use whatever data capture system you want. And then I would work with you to kind of move your data from that into the NTRR. We can't set up a API or anything. It really is a matter of converting to CSVs, but I'm here to kind of help you through that process. So you can do everything in Proforms that I'm sure you all are used to doing, creating your CRFs, collecting and viewing, of course, the data. So that is back in the system. We can go back to home, and then we just have the Proforms right here. Once again, not going to get too deep into it for today. Here are some examples of studies that are currently using it to collect data, and we could spend time, building that out and creating your protocol for your particular study. So that's all of the modules in the system. I do want to say we have a whole lot of valuable information if you want to learn more about them. We have our public site, ntrr.nih.gov. We do have some videos that go over the modules as well in a little bit more detail. I will say that these are training videos that are meant for all of the BRICS system. So it would be any user that is using any of the repositories because we're all using the same infrastructure. Essentially, it works the same. There's some very minor details when you actually log into a repository that it might look a little bit different, but all of the repositories use the same modules. So there is some videos as well as training available on our site. I do want to take this time to mention, this is housed at NIH. So it's currently available, even with the government shutdown. All of our users still have access to the system. But as you can imagine, we have some other things that were, potential roadblocks currently. So um, one right now is our data access request. So if you are submitting and you'd like access to the system, you can by all means work with me to submit all your documentation to get access to the system. We do have, though, however, members at the NIH who then review that request, right? We want to make sure that this repository is being used in the correct manner, and only those that should be getting access to the data get access to the data. And because we have some members at the NIH who would be reviewing your request, they're currently furloughed, so we aren't able to process them currently, but that doesn't keep you from being able to submit your request, get all your data, get all your documentation in, work with me to do that. And then that way, as soon as the government opens back up, you're kind of first in queue for that data access committee to review your request. We have some other things that we're working on regarding updating the public site. So something like making this video public, right? There's going to be a little bit of lag in being able to do that currently because our public site is hosted by the NIH. So now we're in the Q&A portion. As Pam mentioned, we're going to first go through any potential comments that were left in the chat and go through those first. And then we'll open up the mics for anyone else who has any further questions about kind of anything that I covered.
Thanks, Nick. There is one question from Shane who asked, are we able to tell how many total publications have been generated using the NTRR?
Um, so how many studies were published using the data that already exists in the system? Is
That's
that
what
the
I think the
question?
question is, but Shane can elaborate if he is still on.
Hey Nick, nice to see
Yeah.
you. Yeah, so just and then Anthony kind of chimed in there as well. Just is there like a reference list that uh, of of papers that have utilized your resources? And then along that same line, after somebody submits a request, say I submit data into the NTRR just so that other people can use it. Is it just the honor system that they cite me or our group, or do you guys actually follow up with these folks?
Yeah, great questions. I'm not sure. I know that for the NTRR, there isn't currently a list of studies that have been cited in future work because we haven't gotten to that phase yet. I will follow up. I'm not sure. That's a great question. I will follow up with my contacts that run the FITBR repository. We work very closely together because these repositories, right, are kind of linked. If we don't currently have that, I would highly suggest that we do. Michelle, do you want to jump in? Do you have some knowledge on this question?
Yes, so great question. When someone applies for an account to receive data, they sign an agreement that stipulates that they will cite the original research, the paper, as well as the digital object identifier that is associated. It's created by the repository for that data set. And then we also encourage folks to, reach out to the PI because that's the best way to make sure you understand the data that you're looking at. But that's not a requirement. We are so early in the process that we don't. You're right, Nick. We don't have any instances yet of someone pulling down data from the meta and reanalyzing the data and publishing it. Because that process takes a while, and We just started uploading the studies earlier this year, but we do plan to track that and follow up with users on an annual basis about what have they done with the data, and have they published.
Thanks, Michelle.
I've unmuted everyone also, so if you have any other questions, this is the time to ask them. I will note that probably later today, this recording will be available on our website. I'll send out the link to it, and as well as I'll send the slide deck to everyone who registered. Well, if there are no more questions, oh, Nick, go ahead.
Yeah, sure. Yeah, if there's no further questions, please keep an eye out. We'll be communicating about our next webinar where we're going to do a deep dive into the submission process. So there's quite a few steps to it. The idea is that I'm here to kind of help guide you through that process and make it as easy as possible. But the idea is that we're going to do a much deeper dive on things, on modules such as the data repository. So how do you create your study? How does the actual mapping of figuring out what you want to collect versus what already exists? And how do we create new things? Things like that. So we're going to, the idea is to delve deeper into that data submission process on our next webinar, and also kind of touching on topics for the future. If there's anything that we talked about today that you feel like was, you'd love to learn more about, we can definitely either, set up a time to meet or, add that to our list of future webinars. We're trying to, educate this population as best as we can so that you guys understand how it's used and make it as easy as possible to use for you. So, any feedback you guys have on what would be useful to you, we'd love to hear.
Thanks, Nick.
And then finally here, if you do have any questions or want to set up a time to meet with me to discuss, further, here is my information, nick@nattrauma.org. That'll go directly to me. And then we also have kind of a general operations email as well, that goes kind of to all the members of the staff who work on the project. So please feel free to reach out.
Thank you, everybody. You'll see an email later today.